The Zambia Flying Doctor Service, based at Ndola Airport in northern Zambia, is the only public flying doctor service in the whole of Central Africa.
The Zambia Flying Doctor Service was established in 1965. This was just 1 year after independence.
Zambia's largely rural population is spread out over 750,000 square kilometres of central southern Africa, more than 3 times the area of the United Kingdom. 1/4 of Zambia's inhabitants live far away from the main centres. Some villages are 6 hours' walk from the nearest dirt road. In the rainy season, when the roads are wet, it can take days to reach the nearest town, if it can be reached at all.
By the shoulder, okay. That's it. That's it. Okay.
The flying doctors run 33 clinics throughout rural Zambia, providing primary health care, emergency evacuation and specialist services to 1.5 million rural Zambians.
How far can we provide the services that we provide in an urban area in a rural environment?
You start off a debate on something that's very complicated and very difficult. Of course, not everyone can have the same amount of medical care. If you're living in a remote area, miles from anywhere, how can you possibly have the same standard of medical care as if you're living in a big city with a big hospital and facilities and so on and so forth? It just happens to be a fact of life.
We know, for example, that the ministry cannot provide specialists at each one of the district hospitals. But with the support from Flying Doctor Service, we can ferry the various specialists to go and provide that particular service at a district hospital.
For almost 30 years, the Flying Doctor Service worked alongside a public health system in which private health schemes were outlawed in 1975. Zambia's government of the 1990s has brought a new challenge, developing policies which require the Flying Doctor Service to find new ways of sustaining its own operations.
If Zambia Flying Doctor Service is going to be servicing a particular district, there should be an insurance cost paid out to Flying Doctor Service by the council, so that whenever there is need for emergency in that area, that has already been covered.
The Flying Doctors purchased 4 twin-engined Norman Britain Islander aircraft in 1970, only 2 of which are currently operational due to a lack of spare parts.
Due to financial constraints, we don't have all the spare parts available at any given time. So once in a while and so on, things give up and we get stuck in the bush, they come to rescue us.
The high-octane aviation gas needed to run the Flying Doctor's aircraft is 5 times more expensive than modern jet fuel. It's too expensive to keep a reserve supply. For 5 days, the planes have been grounded, waiting for the fuel to arrive. At a remote clinic, one of the Flying Doctor's own workers has become critically ill. She is waiting to be rescued.
We are quite committed to saving life and at the expense of our own lives sometimes.
Roger, and what is the state of hemoglobin? And what is the blood pressure? Did you put the patient on any antibiotics? Put the patient on Flagyl, 400 milligrams, 8 hourly, and put the patient on paracetamol, 1 gram, 8 hourly, and monitor our pulse rate and report this afternoon.